Good morning. Today discussion on continuation of principles of tooth preparation. In previous class, I have to discuss about introduction, objectives, some principles of tooth preparation according to Schellenberg, Rosenstiel. Preserve principles of tooth preparation, preservation of tooth structure, retention and resistance form, structural durability, marginal integrity, and preservation of periodontium. Preservation of tooth structure. Miller states that preservation of which remains is most important than the meticulous replacement. Coming to the retention and resistance form. Retention prevents the removal of the restoration along the path of incision on the long axis of the tooth. This can be defined as ability of the preparation to prevent displacement of the restoration in direction opposing to the path of incision. Primary retention and secondary retention. Primary retention includes sleeves retention, wedge retention. Secondary retention includes retention obtained from the retentive features like pins, boxes, grooves, etc. Taper, freedom of displacement, length. Greater the height of the crown, better the retention of the restoration. The length of the crown improves retention in two ways. First, the height of the prepared tooth should be greater than the tipping arch of the displacement to prevent the displacement of the restoration. This is more evidence in molar tooth. Secondary, increase in the height, increasing the area of the cementation, there provides the greater the retention. Path of incision, it is an imaginary line along which the restoration will be replaced on the removal from the preparation. It is of special importance when preparing to be fixed partial denture abutment, since the path of all the abutment prepared should be parallel to each other. A path of incision must be considered in two dimensions, facial-lingually and mesodistally. In facial-lingual orientation of the path can be affected the aesthetics of metal ceramic and or partial veneer crowns. The mesodistal inclination of the path must parallel the contact area of the adjacent teeth. So, if path is inclined mesially or distally, the restoration will be held up to proximal contact area. If the both eyes are open, the preparation view undercuts may remains undetected. Intraoral preparations are viewed through mouth mirror using one eye. A path of incision of prepare should be parallel to adjacent tooth. Coming to the structural durability. Structural durability is defined as ability of the restoration to withstand destruction due to external forces is known as structural durability. A restoration must contain a bulk of material that is adequate to withstand the forces of occlusion. The bulk must be confused to the space created by the tooth preparation. Adequate reduction during preparation is mandatory to mandatory to obtain adequate thickness of the restoration. The amount of reduction required for the structural durability depends on the types of restoration materials being used and designed of the restoration. There and coming to the occlusal reduction, occlusal strength is the most vital as most of the force affecting the restoration act directly on the occlusal surface. Inadequate clearance may lead to weaker the restoration, an important feature for providing adequate bulk of metal and strength to the restoration is occlusal clearance. Clearance should be metal ceramic rounds 1.5 to 2 mm in functional cusp, 1 to 1.5 mm in non-functional cusp. In all ceramic restoration, occlusal clearance should be 2 mm clearance in both non-functional and functional cusp. Gold alloys requires 1.5 mm clearance on functional cusp, 1 mm clearance on non-functional cusps. The occlusal reduction should reproduce the basic inclined plane pattern of the occlusal surface without overshortening the preparation rather than being cut as one flat form. Coming to the functional cusp bevel, it is provided to increase the thickness of otherwise a thin occluso-gingival junction of the restoration. It is an integral part of the occlusal reduction. A wide bevel on lingual incline of the maxillary lingual cusps and buccal inclination of the mandibular buccal cusps provides space for an adequate bulk of the metal in an area of heavy occlusal contacts. If a wide bevel is not placed on the functional cusp, severe problems should be occur. If the crown is wax or cast to normal contour, it can cause a thin area of perforation in casting. To prevent this, crown may be waxed to optimum thickness, resulting in over contouring or poor occlusion. It is prepared on palatal cusp of maxillary and buccal cusp of mandibular posterior teeth. Additional thickness in this region is necessary because the functional cusp of the tooth is one which bears the maximum load of the mastication. If an attempt is made to obtain space for an adequate bulk in normal counter casting without a bevel, it will result over inclination of the buccal cusp. It will lead to destroy excessive tooth structure while lessening retention. Less in retention. Coming to the axial reduction, the adequate axial reduction is necessary for structural durability. Inadequate axial reduction may lead to a over countering proximal surfaces, which can lead to periodontal problems. The required taper should be obtained during axial reduction. Over reduction will lead to the loss of retention. It plays an important role in space for an adequate thickness of the restoration material. Inadequate axial reduction can cause thin walls and a weak restoration subjected to distortion, or a bulkous over counter restoration which will strengthen the restoration but may have a distortion effect on periodontium. Usually the axial reduction is done such that the abutment parallel to each other, but the mandibular premolars, the tooth inclined by 9 degrees. Hence, the preparation is also inclined in same angle to avoid the excess tooth reduction. Other features which increase the structural durability are offset grooves, occlusal shoulder, isthmus, proximal box. Structural marginal integration and preservation of periodontium. We continue on next class. In next class, finish lines also have to discuss. Finish lines, marginal integrity, and preservation of periodontium. Thank you.